Previously on Debórah.
We are dealing with some junkyard nasty bugs out here. You've got a sinus infection or you've got a urinary tract infection. And you don't have to miss but 2 or 3 doses of this antibiotic to mutate this bug into something that will come and get you. If it's a sinus infection, you can get pneumonia. If it's a bladder infection, you can get a kidney infection, both of which can kill you.
It's time to sit down with someone you know. It's time for Debórah, bringing you the stars, the stories, and the performances. With your host, Debórah Benton. And we're back on the Debórah Show with Dr. Kenneth Cowens, and he is just sharing with us his passion for the medical profession that he practices as well as for his patients and their care. So Dr. Cowen, just before we took the break, I mentioned that I was aware that you are very passionate about the metabolic syndrome. And would you start off by explaining to our viewers what that is?
All right. The metabolic syndrome, first of all, the syndrome is when several different conditions come together to cause or to make happen certain other conditions. They increase the risk or frankly cause other conditions. It's not quite the same as a disease, because in a disease state you have a reproducible, very reliable, if this, then this kind of relationship. That's not quite what you have with a syndrome. A syndrome is a collection of conditions that just happen to come together, and then you get these bad things that occur as a result of that.
So then if you knock out any of the elements that brought the syndrome together, I guess the syndrome would be like your perfect storm?
Yes.
And then if you knock out any of those components, you may have a different result?
You decrease the likelihood that you'll have a bad result.
Okay.
But a perfect storm is a very, very good comparison. The metabolic syndrome occurs when you have morbid obesity, you have glucose intolerance.
And glucose intolerance is?
Glucose intolerance is what we used to call prediabetes. In other words, a person's blood sugar is running high, but not high enough to be diagnosed as diabetes.
Okay.
When you have an increased amount of abdominal fat.
Okay.
When you have elevations in blood pressure, what we call pre-hypertension.
Okay. So these are all pre-stages so far?
These are pre-stages so far. When you have these things coming together, you also have changes in the cholesterol, where the good cholesterol is too low, the bad cholesterol is too high, the triglycerides are too high. When these things come together, you increase the risk of heart attacks, you increase the risk of strokes, you increase the risk of kidney failure, you increase the risk of frank diabetes.
So in terms of this condition or this syndrome, is it something that most Americans in some fashion or another, I should say most Americans who are either borderline morbidly obese, or in other words, who's more predisposed to these things?
Well, Americans are.
Americans in general? Americans in general.
40% of the adult population has metabolic syndrome, at least. 25% of adolescents and growing have the metabolic syndrome.
So then, okay, if they have it's a syndrome, but are they having symptoms yet, or is it just something that's looming?
They're not having any symptoms. They're having symptoms, but they aren't aware they're having symptoms. The problem with the metabolic syndrome is, for lack of a better description, it's a generational curse.
So you got to give me more than that. I'm still lost.
Obesity.
Okay.
Obesity is a paradigm in this country.
Sure.
Paradigm in the sense that healthy is fat. We teach it to our children. We believe bigger is better. We believe bigger portions are better. We believe food is better if it's in larger portions.
But wait a minute. I think, at least from what I've been seeing, I want to challenge that. Okay. Right. If I'm not mistaken, we teach that skinny is better, but somehow or another we don't make the correlation between eating a whole lot, because we do like supersize of everything.
That's right.
But we somehow don't do the math and think skinny is better, but yet eat all you can.
That's right.
So the obesity factor, well, and then I got to go back on that one, because I have noticed that there are some cultures within our society where we celebrate bigness.
We do.
So talk to me about some of the symptoms and...
Well, the reason I call it a generational curse is because the habits that are learned, the lack of exercise, the amount of food we eat, the kinds of food we eat, the way we prepare the food we eat, the way we interact with the healthcare delivery system, the way we even look at our body habits and conclude our self-esteem is learned behavior. It's learned behavior, and we didn't learn it as adults. We learned it as children.
Yeah.
We learned it somewhere between 16 months and 5 years when our brain, our nerve system, our total ability to perceive the environment is growing at a phenomenal rate. We take it in ways that we don't even know. And the behaviors start to come out of us, and we can't trace them back. We learn from our parents. We learn from the people who bring us up.
Even simple things like when you do well, we give you a cookie.
That's right.
Yeah, okay.
Just another simple example. Mothers bring their children into the office to get immunizations.
Okay.
The bribe. I'll take it at McDonald's.
Yeah.
I'll take you to get some ice cream. I'll take you to get a donut.
Stay tuned for more with Debórah. The Debórah Show is brought to you in part by L.E. Black Phillips and Holden Funeral Home, located at 1951 McGuffey Road in Youngstown, Ohio. L.E. Black Phillips and Holden Funeral Home, honoring the legacy of life. The things that you have described, they all look so insurmountable. So you as a physician, what is it that you think you can do in terms of making a dent in some of the problems that you see?
Well, read your Bible. Read your Bible. When Joshua finally had seen that the chosen people had paid their debt for messing up, and they had gone across the desert enough times, and finally, they could go into Canaan land, he made absolutely sure that everybody thought about God 24/7, especially the children.
Okay.
Especially the children. Meditate on God. Meditate on His Word. Meditate on His way of doing things. Focus on Him. Focus on what He wants. Walk and talk and learn to know and love and serve Him in this world. Do things the way He wants them done. That's something that it was very important to teach the children from the time they could perceive.
Okay.
That's how you reverse a curse.
So how do you, as a physician, what is your roadmap to making that happen?
All right, the first thing you do is you show parents, you show people, adult people, how it is that they can impact their own health. Even if you have to tell them in no uncertain terms, if you don't stop doing this, you'll die. If you have to draw horror pictures for them about what it's like to have a heart attack, what it's like to have your kidneys shut down, what it's like to have to be on a dialysis machine 3 times a week.
You know, if I can put a pause there, I think that's interesting because one of the things that I noticed about people, especially as it relates to obesity and problems and conditions that they take medicine for if they're not educating themselves to the process, is, let's say, for example, if it's a person goes to the doctor and the doctor tells them that they're diabetic. Well, they've heard that term probably most of their lives, and they know that you take medicine for it, but nothing else seems to trigger.
Well, the tragedy is not just that. The tragedy is that they know diabetes runs in the family, and they develop this kind of morbid optimism. What I mean by that is, well, by this time, my mother had lost a toe and she'd had a stroke, and I haven't done that, so I'm doing better than she is.
Yeah.
Okay, that's kind of morbid to me.
I agree.
Yeah. You have to teach them not to settle for that. Again, I got to say, read your Bible, okay? You got a God who loved us enough to send His Son to fulfill a prophecy, walk the walk, talk the talk, down on the cross, rise up to fulfill a covenant, and the whole time He's saying, my Father brought me here so that you could have life and life everlasting. I mean, that's the beginning and the end right there. If we have a God who wants us to live and we're not walking the walk, we need to get in line with Him.
So then how do you approach patients who don't believe in your faith?
I reason with them in terms of what their condition is. I explain to them in very basic terms what you have, how it can affect you, what we can do, and what will happen if we don't do it.
Okay.
Then I set up a contract with them. Now, I've lost more patients who would not walk the walk that I have brought around.
Now, when you say lost, are you talking about they expired or they left your practice?
They expired or I put them out of my practice.
Wow. You don't play.
No. But I had to learn that. Because when I came out, I was so determined to stamp out disease and pestilence everywhere I saw it that I just gave up pieces of me. And I found out something that Joshua learned too, you know, bleeding hearts bleed out.
Yeah.
Bleeding hearts bleed out. And you have to stop that bleeding before you can be healthy enough to help other people. And you have to know, even Jesus said, don't cast your pearls at the feet of swine.
Okay, so let me ask you this. I know that you served on a number of boards and panels and on commissions that studied in particular high blood pressure, hypertension, and heart disease.
Well, yeah, the first, I was involved in the All-Hat study, which is still the most important landmark study in hypertension that we've seen since the Framingham study that was done. All-Hat is an acronym. It stands for Anti-Hypertensive and Lipid Lowering to Prevent Heart Attack Trial. This is a trial that involved 39,000 people in the United States and Canada. And it was not just important because it involved so many people, but it was the first study in which the medications that we use to treat Americans at large for high blood pressure were tested in large numbers of black people. You have to understand that before then, you had white people in the studies, and any benefit or side effects that occurred in that cohort of white people was extrapolated to black people. In other words, we don't have any black people, but we'll give it to them anyway, and you didn't get the same set of effects. You didn't get the same profile.
We all like to think that we're really the same on the inside. So was there a big difference in the outcomes of the study with the whites with that particular medicine versus the study that you were involved in with blacks?
Well, the reason that it was important to have enough black people in the study is because black people traditionally did not respond as well to the same medications that have been tested on white people. Black people have some variations in our physiology, specifically with respect to our kidneys. Because of what we call the African diaspora, the transition of our gene pool coming from Africa to a more Western climate, we still have a kidney, and the business end of high blood pressure is the kidney, that retains a lot of salt and water. Okay. And that is an environmental, that is, for lack of a better description, evolutionary modification, because if you live near the equator, where it's hot and it's dry, you want to be able to retain salt and water so that you don't dry up.
Oh, okay. Wow.
So African Americans traditionally tend to have a tendency to hold more salt and hold more water.
So now how many people know that?
Well, just about every doctor in the country knows about it now, thanks to the All-Hat study and other small studies like that. The study involved not only black people, but it also involved black doctors. No other study had involved the numbers of black doctors, black nurses, black healthcare professionals across the country. So African Americans were enfranchised into the research community in a way that we had never been enfranchised before. It changed everything. And it also made the federal government wake up and say, okay, from now on, if anybody is coming to the federal government for dollars to do research, you have to make sure that your study contains a proper, appropriate, reflective number of African Americans and Hispanics. Otherwise, we're not going to give you any money. It changed everything for the better.
Are you looking for office space for your business with room to grow? Look no further than Park South Development, right in the heart of downtown Youngstown. Whether your taste is for a luxury suite with a view, or just the basic professional setting, or something in between, Park South Development offers prime location, excellent maintenance, reasonable rates, and a secure facility. So give them a call. Word is, Park South Development tenants are the happiest in town.
What we have now, at least what comes out now in terms of outcomes, is reflective, for the most part, of what you will see in terms of benefit and side effects in everybody, all Americans, not just white people.
Okay.
And that's a wonderful thing. That, to me, was a great thing.
Yeah, I applaud you on that. Okay, so, and that was specifically dealing with the medicine lipid?
It was dealing with high blood pressure and high blood pressure medications.
Okay.
And also cholesterol medications. to see if you had people who were high risk by age, by race, by having high blood pressure and or having had a stroke and or having high cholesterol and or having had what we call hypertrophy of the heart, which occurs as a result of uncontrolled high blood pressure. If you gave them certain medications and you put them on a diet and you got them to exercise and you got them to go to the doctor and do everything right, which medication would make the biggest difference as opposed to the other 4 that were in the study?
Okay.
And what we found out is that the single medication that consistently did the greatest job of making a difference in how long these people lived and how much time they spent in the hospital and just overall good was a water pill.
Really?
Now, I personally believe that the reason that the water pill did so much good is because you had so many black people in that study. Again, we hold water. We hold salt. You give us a water pill, you get rid of the extra salt and water, you lower the blood pressure, you decrease the damage. And I'm not by myself.
And I mean, I've known that people take water pills who have high blood pressure, and I knew that it was to relieve the water from their...
That's very true. But going back to role models, one of my role models is Dr. Elijah Saunders, brilliant man who's also a minister and a Christian.
Yeah, I'm familiar with Dr. Saunders.
Who's the director of the Division of High Blood Pressure at the University of Maryland. He was one of the coordinators of the All-Hat study. And for years before the study took place, he was preaching like John before the first coming about water pills, water pills, water pills. Whatever you use a water pill, water pill, water pill. Because he had the data, and he generated the data that proved that in our people, when you use water pills with any blood pressure medication, you get a better outcome. You get better control. And now giving a water pill is standard hygiene with any blood pressure medication that you are going to use to treat people with high blood pressure.
Wow.
It's a matter of hygiene. It's almost like before you eat, you wash your hands. If you got somebody with high blood pressure, the first thing you offer them is a water pill.
Okay.
That's what we did. That's what he did.
Okay, we're going to take another commercial break, and when we come back, we're going to get more into where to from now with Dr. Kenneth Cowens. Right back on the Debórah Show after this.
Stay tuned for more with Debórah.
And we're back on the Debórah Show visiting with Dr. Kenneth Cowens as he shares so much of his heart and his passions with us and so much really great and viable information. And thank you for that, Dr. Cowens.
My pleasure. My honor.
Okay. Some years ago, Bill Cosby came forward and he took some heat for criticizing the dumbing down of African Americans, where he talked about, things like ebonics and so many things that we see, the degradation that we see in our culture. And he just put it out there. He didn't sugarcoat it. And he talked about it for what it was. It's not helping anybody. It's not helping us get jobs. It's not helping us to be masters in any given fields of education and academia or anything else. So let's say you were the Bill Cosby of healthcare. What would be your message to African Americans in particular, and even to Americans in general, about their health?
I would tell them that the most important player in the healthcare game looks you in the mirror every morning when you get up. I would tell them that it doesn't matter how much money we spend, how much research we do, how good the technology is that we have, if we can't get you to walk your walk and participate in the interaction so the outcome can be good. I would tell them it doesn't work unless you show up. And I would tell them to show up, you've got to learn what we're doing. And finally, I would tell them that the most powerful weapon that you have whenever you go to a doctor, a pharmacist, or any healthcare provider is a pencil and a piece of blank paper where you write down what they tell you and you write down the answers to questions that you brought. And I have seen that that is powerful, and it makes a difference, and you have to do it because it works.
Well, we appreciate all the great information from Dr. Cowens. And before we close out, though, you've got to tell us what it is you're currently working on, because as a matter of fact, if I can digress, I remember a recent conversation I had with you where you came to an epiphany of sorts.
Yes, I am doing some work in the correction system right now, and the epiphany came when I saw so many African-American young men who have so many disease states and so little information about how to take care of themselves. And this is another conversation, but our young men do not have a wholesome, solid, positive sense of physical self-esteem. Somebody who knows better, somebody who knows the difference has got to step up and say, it's not like that, brother. This is the deal. This is what it is. And no politic, no policy, no set of appropriate circumstances, it can be powerful enough, can be important enough not to step up and address that problem, because it is not going away. It existed when I was a baby, it existed when I was a young man, it exists now, and it shows no signs of going away anytime soon.
So just in a few minutes here, can you kind of give us a hard example of what you're talking about? A young man who was incarcerated for robbery, who proudly touts having a history of sexual prowess and multiple STDs and different children. He proudly talks about the STDs? Yes, because that reflects the numbers of encounters that he's had, or conquests. Wow. And he doesn't understand that there is a more important critical component of his manhood that has yet to become, that has nothing to do with what he's done so far and these encounters that he's had. And that begins with the responsibility he has for his own body and the potential to transmit the diseases he has to other people from now on. Now my challenge as a Christian, as a doctor, as a man, is to get his attention, get his respect, gain his trust, and change his thinking. That's what role models do. Okay, yeah. So, got to ask this question. Looking at your task, do you run into much resistance in trying to change things? Some. Or shall I say, what are the challenges that you encounter? I think the biggest challenge you run into is the lack of acceptance of what I'll call the establishment to understand and accept the existence of a plurality of culture. Where it's kind of cookie cutter, one size fits all? Or? Yes, where you can't have... I, as an African-American male, can talk to an African-American male and be received more effectively than if I wasn't an African-American male. Okay. Because I look like him, I talk like him, I walk like him. Consequently, at some intuitive level, that individual is going to feel my life, or that his life is more important to me. Okay. Because we have so much in common. And that's not just African-American, that's any ethnic person to another member of that same ethnic group. It stands to reason. I think we forget that, and we can't afford to forget it. I don't think anybody else would be willing to forget it. But the poignant lesson to me was I got reminded of that in this situation, and that's, as God gives people power, that's part of my power. And as we were talking about, you can't take a light and put it under a bushel. You got to put it on a rock so everybody can see it. Do you have any more CDs coming out? I know you have CDs available on prostate cancer. We have the ones on prostate cancer. We have the one on hepatitis. We have the one on lead poisoning. And really, since you and I have been talking and you've been punching me and making me suit up, we're doing the notes for the one on the metabolic syndrome. Oh, great. So God willing, that'll be out before Thanksgiving. Yeah, well, and we're going to close, but I just want to say I feel so honored and privileged. You know, I told you before how I had listened to you on the radio some years ago. And for our viewers, Dr. Cowens is really a famous doctor in this region. And everybody that I knew who was seeing a doctor, if they were really happy with him and felt that they were getting aggressive treatment to help whatever their conditions were, somewhere in the mix was Dr. Kenneth Cowens' name. And so I came across your radio program. And even though, and you talked a lot about hypertension, hepatitis C, diabetes, a lot of the conditions that plague, in particular, the African-American community, but now it's kind of spreading. But anyway, yeah, I would listen to your program very intently because even though I didn't have those conditions, I found you to be so compelling. And so I'm just really thrilled that I finally got that doctor to sit here on my show so that I could share some of this wonderful wisdom and passion that you have in helping people with our viewers. So we're going to, that's it for the Debórah Show. You can get more information. We'll make sure that we put information on our website about Dr. Cowens, as well as give you contact information. Our website address is thedeboraHshow.com. And until next time, that's it. Bye-bye.